Good morning. My name is Caroline Elton and welcome to the Medicine on Track webinar. I hope that you're going to enjoy it. I'm just going to begin with a little bit of housekeeping, not where the emergency exits are in the building. I'm actually sitting in Canary Wharf on the 33rd floor in the MDU, so I hope there's some good emergency exits where I am, but not that sort of housekeeping, just really about how you can ask questions as we're going throughout the presentation. You should either have a dialog box, or if that has minimized, there should be a little box with a red arrow on it. And if you click on the red arrow, the dialog box will come. And you can see where it says chat, and you can type questions. And please feel free to type questions at any point as we're going through it. And the important point to say is that nobody else can see your questions. So you can ask whatever question you would like. I may know the answer, I may not know the answer. If I don't know the answer, I'll get back to you after. I'll find the answer and get back to you. So the first question that I'm going to ask you guys is which medical school did you go to, and which foundation program are you going to be starting in the beginning of August? So I'm just wondering what the answers to that question will be. Can I start seeing them, Matt? Ah, good, amazing. Well, it looks pretty much like we've got the whole country, so that's absolutely fantastic. A really good spread of foundation of people who are just about to be going into foundation. So I'll just begin by introducing myself. As you can see, I'm Caroline Elton. It says I'm Dr. Caroline Elton. I'm wondering why the next slide is not coming on. Luckily, I've got some technical assistants here to help me. I am an occupational psychologist. I'm not a medic. And the experience that I'm bringing to the table this morning is that for 6 years, I headed up the careers unit at London Deanery. So I was responsible for careers support for foundation trainees, but actually for everybody, all trainees and as well as some non-trainees across the London region. In that role, I have personally counselled hundreds of junior doctors who are experiencing small career difficulties and sometimes very major career difficulties and everything in between. That's what I'm going to be bringing to this webinar. I also want to say a word that this has been written in conjunction with foundation faculty. So I've brought my own experience to the table, but I also want to make sure that any advice, any ideas that I'm going to be sharing in this webinar also accords with foundation faculty. So that's a little bit about me. Now let's think about the webinar. We're going to be looking at 4 things this morning. The first thing is the main aims of the foundation program. What are you actually trying to get out of the foundation program? What's its purpose? The second thing is just briefly to think about your preparedness, and I'm going to compare the results of this survey, of this sample. I don't want to say you're a random sample, but we're going to look at how prepared you feel as a sample and compare that to the 2014 GMC survey. The GMC does a training survey every year, and that you will be included in that next year. A little bit about your e-portfolio, and finally I'm going to talk about the Medicine on Track resource, because this introductory webinar is just to introduce a resource which is going to be available for MDU members throughout the whole 2 years of your foundation program. So that's what we're going to cover. How long is it going to take? Well, approximately 20 minutes for me talking, and you don't want to listen to me talking for 20 minutes, so interspersed with me talking there's going to be some interactive polls, but when nobody knows what your own response is to these polls, it will obviously be anonymized. Then questions and comments, I can see who's written the questions and comments, but when a question and comment comes into me, other people can't see it, and that will be approximately 10 minutes. So that's the plot, that's the plan. Let's go. First thing then, the main aims of the foundation program. As probably you know, as many of you, not many of you, but I bet quite a few of you have medical parents, maybe a medical mum, a medical dad, or a medical grandparent, and they wouldn't have gone through the foundation program. The foundation program started, I think, in 2005, something like that. It's been around for about 10 years. It was piloted before that. You know, it's a 2-year program, and its function is to serve as a bridge between medical school and then your specialist or core or general training that you go on to. First of all, thinking about F1, and this is really where you're going to begin supervised responsibility as a doctor. As a medical student, you can carry out clinical tasks, but actually you can never assume responsibility. But as an F1 doctor, although you're supervised, you're actually beginning to assume clinical responsibility. And it therefore forms a way to consolidate all the hard learning that you've done 5 years, or maybe 6 years if you've intercalated, or maybe 4 years if you've done a graduate entry program, but then you would have built on what you've done before. So you've been studying for a very, very long time, and now is the time to really start putting all that great stuff that you know, all those skills you've acquired, all that knowledge into practice. F2, you're also going to remain under clinical supervision, but you will be having increasing responsibility and be expected to begin to make management decisions for the clinical care of the patient. So there's a step up between med school and F1, and another step up between F1 and F2. So that's the aims of the foundation program. So here's the first poll. How many of you actually looked at the UK FPO website? Map the poll, please. Okay. So around 10, great, I'm really impressed. Around 90% of you have looked at the website. That's fantastic news. 88%, it's sort of, people seem to be changing their minds. Well, I suppose they're not changing their minds, more adding in. Let me think. I'm a research psychologist. I should have the ability to work that one out. Really great that around 88% of you have. Those 12% of you don't walk in blind without any knowledge of what's going on. Check it out between now and when you're actually starting at the beginning of August to get more of a sense of what it actually involves. So let's have a look. How many of you have actually looked at the foundation program curriculum? Matt, the next poll, please. Interesting. So it's around about, we've got 81% voted, pretty much around 50%. 50% of you haven't yet checked out what it is that is going to be expected of you in the next year, next F1 year and the next F2 year. That really is a no-brainer. So one of the things you might want to be doing after the webinar is really looking at the curriculum, because it lays out, it's on the foundation program website, it lays out in some detail what is going to be expected of you. And also, of course, it gives you some armor, because if you are, for whatever reason, in a situation where somebody asks you to do something that you feel is beyond your competence, and you then look and see it's not in the curriculum, that gives you some pretty good evidence as well that you can say, no, you don't feel happy doing that. That's highly unlikely, but it's really going to help your progress if you have a look at what is expected of you in the next period of time. So, 2, let's think about how prepared you're feeling to start. So this, we're going to compare your results to the National GMC survey from last year. Map the poll on the preparedness, please. Okay, so around about half of you agree that you feel prepared, a quarter are unsure, and getting on for a quarter are clearly saying that they don't feel prepared. How does that compare with the national, this sample, So it suggests that the sample of people logged on are feel less well prepared. Now this might be the timing. I'll have to go back and look and see exactly when the GMC survey was launched, or it might be that people who are feeling a little bit more anxious, the ones who've logged on today, who knows? But it seems that a minority feel from the GMC survey didn't feel prepared, and about a quarter really weren't sure whether they felt prepared or not. And actually that's pretty reasonable if you think about it, because it's difficult to know how prepared you are until you actually get cracking. Let's look at the next question then. As I said, these are from last year's GMC survey. The skills I've learned at medical school will set me up for working as a foundation doctor. Matt, let's have a look at this one. Oh, 81% voted. Okay, so great. Only a small proportion actually disagree strongly or not so strongly. So 7% disagree, 1% strongly disagree, and that's identical to what the GMC survey found. So that's quite a larger proportion of you are unsure, and I think that makes absolutely good sense because you haven't really had any actual experience yet. The main learning point here, I think, is that most doctors feel a little bit nervous at the start of F1. They don't feel absolutely sure that they've fantastically well prepared and everything they've learned in medical school is going to be enough. And I think that's entirely appropriate. And as a psychologist and as an educator, the doctors who worry me most and the doctors who worry clinical colleagues most are those who feel absolutely certain that they're on top of everything. And a little bit of anxiety about how's it all going to pan out, am I adequately prepared for that, is entirely normal and sort of inevitable, really. So I hope that that might reassure you that if you are feeling nervous, a little bit nervous, or even quite nervous, that most other doctors are going to be like that as well. Okay, but coming on to e-portfolios then. And I don't know, I'm really interested to find out the answer to this poll. What is your experience of either paper portfolios, maybe they're a bit dinosaur-like, or e-portfolios? How many of you have done anything like this in the past? Okay, so about half of you have used an e-portfolio. Just over a third have kept a paper portfolio or some sort of learning diary. 14% have never kept any sort of learning portfolio. Those of you who've done no sort of learning portfolio, no sort of learning reflective practice in that way, it might really be useful for you to do some reading on it, to make sure to look about what they're saying about the portfolio on the Foundation Program website. If some of you, obviously, if you've had to keep an e-portfolio in med school, it's not going to be really different, and that's great. But those of you who either have kept a paper portfolio or haven't done any sort of learning portfolio, you really need to try to prepare, because as we're going to come and see, e-portfolios, the foundation schools are going to give you the information about how to access your portfolio when you start, and it's got different components in it. So it's got some assessments. In particular, they're going to be 360 assessments when you have to get feedback from not only medical colleagues, but from other nurses, from other allied health professionals, sometimes from ward staff, about how they find you as a junior doctor. You have to take a record for your meetings with your educational and your clinical supervisors. and your educational, your clinical supervisors are not one and the same they might be one and the same person for one role, one placement in your F1 year, but they are different roles. Your clinical supervisor is responsible for the day-to-day standard of your clinical care that you're offering in their team. Your educational supervisor liaises with your clinical supervisor. Sometimes they are one and the same for one placement, but your educational supervisor will be the same throughout the 3 placements of your foundation throughout your foundation year, and they are concerned with the sort of arc of your progress over that year. You're going to have to construct a PDP, Personal Professional Development Plan, which outlines your learning objectives. There are going to be all sorts of supervised learning events, which we'll come on to, and you're going to have to write some reflective reports and maybe other evidence of meetings or conferences you go to. And finally, there will be the outcome of your ARCP. That poor guy looks like he's climbing up a very steep hill with his ARCP. I think usually they're a little bit flatter. ARCPs, what does it stand for? I'm interested to know if you actually, which of those 3 does the ARCP stand for? Okay, well, about 80% of you have voted, and nearly half of you think it's the annual review of clinical progression. Well, nearly half of you are wrong. And just over a third of you are right. It's the annual review of competence progression, and you will have an ARCP from now until you finish your training and you get your CCT, your Certificate of Completion of Training. So it's in each post, whether you're a foundation trainee or whether you're a GP trainee later on or a specialty trainee in a different hospital-based specialty, there will be all sorts of competencies which are laid out for a trainee of your level, and you will have an annual review of it in front later on in front of a panel. But in terms of foundation, you don't need to. Not every foundation trainee goes to a panel. What happens is the educational supervisor reviews it and then makes a recommendation to the foundation program training director. So you don't have a kind of huge panel interview at foundation, but there is an annual review of how you have progressed on the competencies, and that is why you should be looking at the foundation curriculum, which is on the UK FPO website, because the foundation curriculum outlines all those competencies. Okay, so part of your e-portfolio will have also includes these SLEs, these supervised learning events, and they give a helpful guideline to the minimum number. So the mini-CX is a clinical evaluation exercise, and really it's a snapshot with a more experienced clinician who does not have to be a doctor. It could be a senior nurse, a senior allied health professional, and they observe you in some sort of, take a sort of clinical snapshot, and then they have a feedback discussion with you. And you need to have 3 or more in F1. And so really you should be doing one of these in your first placement, but you only need to do one. The DOPS is you will have these acronyms, they will just flow off your tongue in the next few weeks. The DOPS is a direct observation, it's an actual procedural skill. It's optional, so it may be cannulation or whatever, with some of the procedural skills which are in the F1 curriculum. It's optional, but it can be used to supplement the mini-CX. The case-based discussion is when you ask, again, you're a senior clinician or other senior member of the healthcare team, if you can actually have a discussion about a particular case and your reflections on it, and that is recorded on a form and goes into your, and there should be 2 or more. So I would say you don't need to really worry about that in your first placement. Developing the clinical teacher is when you take on some teaching responsibility. Maybe you're teaching some medical students, maybe you're teaching some nursing students, but that you do have some sort of teaching role and you get feedback for that. And that's from the foundation program curriculum. So those events need to take place, and the whole point is that they are learner directed. People aren't going to come banging on your door and saying, have you done your homework? Have you done this stuff? You have to take the initiative for it. Okay. This is per placement. Oh, sorry, yes. Oh, this has just been pointed out. I've read this wrong. I've written it right and read it wrong. So let's go back. I do apologize. It's the recommended minimum number per placement. So you are. Sorry about that. Thank you very much, Matt. I got it right because I took it from the foundation program curriculum, but I read it wrong. This is what you are going to have to be doing on each. So you're going to have to do 3 or more on each placement. I do apologize for that. Thank you very much, Matt, and thank you very much those who've pointed on the ball and pointed that out. E-portfolios are like tax returns. Keep them up to date. Do it prospectively as you go along, not retrospectively, because it gets to be a nightmare if you let it all build up. And you've got to remember that in November, not November 2015, but November 2016, so the November of your F2 year, you've got to be ready to make your post-F2 career choices. Now, I used my words carefully on that, post-F2 career choices, not post-F2 specialty choices, because some of you may decide, and this is one of the things that the MOT program deals with, some of you may decide that you're not quite ready to choose your career in the November of your F2 year, and that you may decide to take a little bit more time over deciding what you want to do in terms of specialty choice. But you have to be ready to make choices about what you're going to be doing in November, because applications for specialty are in November, and you've got to decide whether you're going to apply or not. Some people don't apply, and obviously you can apply and then turn down, and there is no problem with doing that, and the year after that they won't know. But you've got from August 2015 to November 2016 to be ready to make some choices. And that's where Medicine on Track is going to be here to help you. So what is it? It's designed to get you ready for specialty recruitment at 2017 preparation. Now you might think that's bonkers. I don't know if you all know that, but the way a recruitment episode is called in terms of the MMC structure, it is given the date of the year you start, not the year you apply. So you will be applying in November 2016 to start in August 2017. And when you apply in November 2016, it will be called Specialty Recruitment 2017. It's extremely confusing, but I'm telling you that because when you apply in November 2016, there will be stuff on the web which is called Specialty Recruitment 2016. And it will be very easy to look at the wrong websites, which often don't get taken down, and to get very, very confused. So the specialty recruitment is the year you start, not the actual year that you submit the application. And what I've attempted to do with this is to break down the overall task of career planning, being ready to make a really informed, robust career choice by November 2017 and submit a strong application. It's not only a question of choice, but also to submit an application that is going to maximize that your choice is successful. There's a lot of intermediate steps in that, and what I've attempted to do in the design of the MOT program is to break down the overall task into a number of much smaller steps. So there's going to be 3 steps per placement. So that means that they're going to be 18 little chunks bite-sized chunks of career planning across the whole 2 years of the foundation program. You're going to get, for each step, so there will be 3 emails per placement. There's going to be a reminder to log on and to do the stuff. And it's based on an evidence-based approach. It's something that I feel very strongly about, because just as clinically you are committed to an evidence-based approach to clinical care, as a psychologist, I am committed to an evidence-based approach to career support. I'm an occupational psychologist. I want to provide a resource that has the greatest chance of really being maximally useful. And it's foundation faculty approved. I haven't just dreamt it and pulled it out of thin air. It's been developed in discussion with foundation faculty from the London Foundation Schools. So how it works really, what will each step contain? You're going to get an email, and remember they're going to be 3 steps per placement, so that you will get 9 of these chunks in F1, 9 in F2. You'll get an email reminding you to log on to the MDU website. You're going to get a checklist of tasks that you need to complete at this point of the year. Many of the tasks link to the National Medical Careers website. But feedback, which is www.medicalcareers.nhs.uk. I hope that most of you have actually looked at it. I'll repeat that, www.medicalcareers.nhs.uk. But it's a huge medical careers website. There's a huge amount of stuff on it, and it's the sort of portal that gives you links to different deaneries, to different royal colleges, all sorts of different stuff. And so what I've attempted to do is to make, by directing you to specific aspects, specific areas of that website, to get you to make that feel more manageable. Interspersed in that is going to be relevant careers advice. It's an evidence-based approach drawing on the medical education literature. And I'll give you an example for that. Some of you may feel that you've gone in, and this is something that we're going to look at in one of the early webinars in F1, that you know what you're going to do. I know from the literature that about half of you will change your minds during. You may be surprised on that, but that's what the literature shows. And based on that, I'm going to encourage you to keep your mind open, because there are people who have experiences in F1. The thing they thought they wanted to do, they discover they don't want to do. And something that they thought that they weren't interested in turns out to be an absolute delight. So I have encouraged people to do this difficult thing of, on the one hand, keeping their mind open, and on the other, trying to build up a portfolio which shows commitment to specialty. And that is really, really difficult to do. But because in a way you're pulled in 2 different directions, but we will think about how you can do that. And throughout I have tried to make sure that, as I said, that the advice is maximally useful. And at different points there's going to be input from current foundation trainees and also from faculty. So additional support, there's going to be the MDU are going to do some FAQ sessions that I'm going to facilitate, and there are going to be some F1 and some F2 webinars as well throughout the MOT program. So, and it's only available to MDU members. So now it's time for some questions. Okay, so let me see. There are an awful lot of questions. I'm going to start with a question that says, I'm concerned that keeping my mind open will result in a CV that isn't aimed at a particular specialty and therefore not strong enough. In the webinar that I'll be doing for F1s, I've got a picture of, I wanted a picture of a push me, pull you from Dr. Doolittle, but I've actually got a picture of a sort of tandem where the wheels are focusing in opposite directions. And I think that increasingly, because there is undoubtedly inherent paradox in this, the reason why, following a number of different commissions on medical education, the foundation was introduced, was to have a longer period of time, a longer period of generic training prior to choosing your specialty. So it went from PRHOs and then SHOs, which would be in a specialty, to having 2 years of foundation training. And so the idea is that you have an opportunity, and also PRHOs had 2 placements, and now you have 3. So I think that what you have to do is that you have to realize that actually it can be a problem if you really built your CV around one specialty and you then change your mind. Undoubtedly it can be a problem, but it's also the case that that is going to happen. What you have to do though is to realize that even if you change your mind, you can use the assessments that you've done, any tasters you've done, to argue. You can argue it about different specialties. You can say, and just be honest, you went in, you did this taster because you thought you were interested in this, that you found out that about yourself or that about the specialty, and that's why you've switched. So actually in the selection process they are looking at the depth of your career planning, the depth of your career decision making, the depth of your knowledge about yourself and the knowledge about the specialty, rather than a tick list of how many posters you've got in orthopedic surgery or whatever. It is about, and I think that's what you have to hang on to, what have you learned about yourself and what have you learned about the specialty, so that you can argue from different specialties. You can use that to make a case if you make a switch, but it's tricky. Can we add evidence from before F1 for our various e-portfolio competencies? I'm not 100% sure on that, but I think the answer is no. But that is a question that I will try to find out about. But I've never heard of anybody actually doing that. So how do I boost my CV for GP training? Now here's an interesting thing. For GP selection, there is no CV station. Your CV will not be interrogated for GP selection. Okay? So people come from each and every sort of background. They come straight from foundation, and they come, I saw somebody, a career counselling client a few weeks ago, who's got his CCT in obs and gynae, and he's going to apply for GP. So you boost the most important thing really for GP selection is that you really understand what GPs like, the challenges are like, and that you understand how the selection procedure, it's the most highly developed, well thought out selection procedure, actually works. They were the first one to really think about how can we model a new form of recruitment and selection. So there is no CV station in GP recruitment and selection. So a quick answer is go on to the National Recruitment Office website and really have a thorough look as to what they're looking for. Okay, I'm interested in some specialties which I will not get to experience during my foundation training. So you can try to do tasters. That's one thing you can do. Not ideal, but you can try to do tasters. Do some reading about the specialty, not about it. Just go and go to the library and ask what's the main journal in whatever specialty it is, and just do some reading and see if it really fascinates you. Talk to people in that specialty. If it's a run-through specialty, then that can be a problem in the sense that, and you may want to try, if it's a specialty which has SHO jobs, to get an SHO job before you absolutely make up your mind. If it's a surgical specialty or a medical specialty that you would need to go through core surgery or core medicine or ACCS, then don't worry too much about it, because, and again this is something that I've talked through with clinical colleagues in the 6 years I spent at the deanery. When you go through core medicine, it is not expected, and core surgery, that you know, when you go to the core medicine, you don't need to know that you want to be a clinical neurophysiologist. So just, you need to know that you want to do a medical specialty. So it's definitely better if you can have access to the specialty that you think that you want to go to, but it's not a disaster. How are we doing? My main worry is making a significant error in F1. Please can you advise on how to deal with this if this should happen? Okay, this issue, if you're talking about a significant clinical error, you shouldn't be in a position of making a significant clinical error, because the supervision, if we go back to that slide, you should have supervision available. The main thing is, if you are not sure, ask. If you are not sure, ask. If you're feeling that you're being asked to do something that you're not adequately prepared for, then you have a clinical responsibility to raise that with the more senior person on the clinical team, and also then you can raise it maybe if you're on nights, or if it's immediately with the most senior clinical person around, and then the following morning you can raise it with your clinical supervisor. If you make an error, you absolutely have to go and tell somebody about it. And errors do happen. It's quite likely, if you make an error, that it's a systemic issue. You can't know that. It's obviously going to depend, but the supervision should be there. But this is also an issue that will be talked about in induction. So if you're unsure, if you don't know what you've have to do, ask. If for whatever reason you feel that a mistake has been made, the way that it is going to have the way to minimize the damage that it is going to have on your career, of course, you know, I can't say it's, if we're talking in great generalities. So the general advice I'm giving is, if you're not sure, ask. If something happens and a mistake is made, you absolutely need to put your hand up to it as soon as possible. But hopefully with adequate supervision and asking when you're not sure, that won't happen. What's the difference between coupled and uncoupled training programs? Okay, a couple, this is to do with the difference between core and run-through. If you go into a run-through program, and it's quite random, it's historical, it's to do with how different colleges reacted to MMC. Some training, it's not to do with really pedagogical reasons. Some colleges, some specialties have run-through programs. That means if you are successful after in your 2017 specialty training 2017 applications, which will start in November 2016, if you get a training number and if you progress adequately each year in your ARCP review meetings, you are guaranteed training posts until you get, and you pass all the different postgraduate exams along the way, but that would be reflected in your ARCPs. You are guaranteed training posts which will allow you to get your CCT, your Certificate of Completion of Training. So GP, obs and gynae, ophthalmology, what are other, pediatrics. There are a number of pathology. There are a number of trainings programs which are run through, and just to reiterate, you get on those and everything, you progress adequately each year. All the positions, you do not have another competitive recruitment for the specialty. You may, PEDS is another run through, you may have competitive recruitment for subspecialty. That happens through the grid process in PEDS, for example. But in terms of being able to guarantee jobs, if your progress is okay, you will get the jobs until you get your CCT. With Uncoupled, there is you go in, for example, medicine or core medicine or ACCS. You get a training number, let's say core medicine, core psych, core medicine 2 years, core psych 3 years. So you get 2 years or 3 years worth of jobs. And then, assuming your progress is satisfactory, you are eligible to apply for ST3. It becomes, it goes C, it's CT1 core medicine, CT2 core medicine, and then it becomes ST3 because your actual specialty. So you go into core medicine, you can also go into ACCS, and then maybe you go into oncology or palliative medicine or rheumatology at ST3. So the main difference is there's a second competitive recruitment round, and in some specialties there's a real bottleneck, particularly in surgery. There is a bottleneck for ST3 specialties. So the fact that you've got core surgery doesn't really mean that you're necessarily going to be able to get your ST3 surgical specialty. Can I leave after F1 and return in the future to do FY2? I'll just finish with that one. FY2, it's a 2-year program. So if you can have agreed time away from the program, but it's going to have to be agreed, and for a health reason, people have it for sometimes, maternity care, or maybe something else crops up, and it would be agreed with the program, and you would come back after a year. But if you leave after F1, not with the plan, the agreed plan to come back and do it the following year, then you are only eligible for the standalone FY2 posts that exist, and there are not that many of them. So the basic advice is that unless there's a sort of compelling reason, finish your F2 because it's an easier point to get back into than to leave after F1. I'm just going to say one more word of warning on that point because there's some issue. That when you finish your F2, as I'm sure you will do, you get and you have your ALCPs, you get foundation sign-off. And you need foundation sign-off to go into the level 1, be it CT1 of surgery, CT1 core medicine, or ST1 of any of the run-through specialties. So to go into the 1-level jobs, which is the first level after foundation, you need foundation sign-off. And that foundation sign-off has a sell-by date. It expires. So you need to have had sign-off within the last 3 years. So you really need to think, if you are going to do different things, there is a way you can get it, an alternative certificate, but it's a bit of a sort of faff. So that's something, we'll talk about this in the MOT resource itself, but it's something that I want to highlight for you now. Well, we've been 45 minutes. And I hope that this has been useful. And if there are other questions, that what I will make sure is that the other questions, if there's some recurring themes, that those get answered, and we can put some answers up, I think, onto the website. Thank you very much. I wish you all the very best for starting in August. It's a bit scary, but on the whole, it's pretty exciting as well. Bye.